On March 17th, Dr. Thomas Boo, the Mono County Public Health Officer, ordered the closures of bars and in-room dining in restaurants. In order to reduce the effects of COVID-19, the state of California has directed and the Mono County Public Health Department has ordered the following, effective at 10 p.m. Tuesday, March 17th. All bars, breweries, and wine tasting venues in Mono County shall close, excluding production facilities that do not include any customer or other public contact. All restaurants shall be closed for indoor and outdoor seated dining, and may be open only to drive-through and other pickup or delivery options. Bars, breweries, and pubs that include full meals provided by a full kitchen should follow restaurant guidance and may provide delivery or pickup options. Coffee shops fall under restaurants may continue to offer pickup service but provide no indoor or outdoor seating for customers. All pickup areas shall limit customer waiting areas to no more than 6 people, providing adequate space for 6 feet of separation between waiting customers and also provide for hand sanitation. Health clubs and gyms are to be closed. Theaters, bowling alleys, and other indoor recreational venues should close. All non-essential public gatherings or assemblies, regardless of size, are prohibited. All venues for gatherings should be closed. Due to the imminent threat to public health, Mono County has declared a local health emergency for the county and town of Mammoth Lakes, which gives the county health officer, Dr. Thomas Boo, broad authority under state law to take actions as needed to protect the health of the public. Mono County and the town of Mammoth Lakes are actively responding to the pandemic in a unified command emergency operational center led by Mammoth Lakes Fire Chief Frank Freivault, Town of Mammoth Lakes Manager Dan Holler, County Chief Administrative Officer Steve Barwick, and County Health Officer Dr. Thomas Boo. The unified town-county response structure incorporates Mammoth Hospital, and they are coordinating with the Inyo County Public Health and Healthcare Facilities as part of the Mono Inyo Healthcare Coalition, under the guidance of state and federal COVID-19 response guidelines. There's a runoff for 4th County District Supervisor in Inyo County. There will be a race between Jen Rozier and Donald Bright in November. Neither candidate broke the 50% plus 1 rule, where an election ends with the primary election, eliminating a November runoff between the top 2 candidates. Rozier had 512 votes and Bright had 489 out of the total of 1,234 ballots cast. To have won outright, a candidate would have had to have had 617 votes plus 1. Candidate Dina Davenport Conway received 233 votes. The 4th Inyo County District is the second largest supervisorial district in Inyo County. It stretches from Wilkerson, just south of Bishop, to Big Pine, Deep Springs, Aberdeen, and Independence. Jennifer Rozier of Independence is married to Lee Rozier, and she is a well-known businesswoman and community volunteer, very active in Mule Days, and a host of other local nonprofit organizations. Donald Keith Bright also lives in Independence. He is the son of former 4th District Supervisor Keith Bright. A former Navy pilot, Bright is a retired commercial airline pilot. He and his wife Laura own a home in Independence. Considering how close the election was, it should be an interesting contest. Both the Rozier and Bright family names are well known in the 4th District. It will likely be a tight race with an even bigger turnout. Inyo County Registrar of Voters Cami Foote said that voter turnout in Inyo County in the primary election held just on March 3rd was 68%, which, as it turns out, was the highest in the state. The presidential election in November should, if anything, bring out more voters. In 2016, the voter turnout was 73.8%. At the Inyo County Board of Supervisors meeting in Independence on Tuesday, Inyo County Public Health Officer Dr. James Richardson talked to the Board of Supervisors and gave them an update on where things stand relating to the coronavirus. Richardson told the supervisors that we've been having meetings with local healthcare providers in various industries in the county relating to the virus. There were some irresponsible rumors circulating around the Owens Valley, coming from individuals saying that others were tested positive for COVID-19. However, Richardson made sure that he debunked those myths. There have been rumors of cases, but right now we have no positive cases, he said. Although there are no confirmed cases in Inyo County, that does not mean there are not any hurdles for the Department of Public Health. Currently, there is a personal protection equipment shortage in the Eastern Sierra. We're short on supplies of PPE, N-95 masks, and we have expired masks we are using in the meantime. We are as ready about as best we can be. Richardson talked about some of the steps his department is taking to curtail cases of novel coronavirus. He highlighted the 4 plans in place to deal with the incoming viral crisis: prevention, containment, mitigation, and lockdown. Richardson discussed how testing is the most important thing public health officials can do to prevent an outbreak of coronavirus. We are trying to do our best to contain any new cases in Inyo County, and we are doing our best to implement testing. We need to test those who are positive for COVID-19 and isolate them from the public, Richardson said. In the present, testing is not as effective as it could be, according to the Inyo County Health Officer. There is currently a long wait time to see if a person has contracted coronavirus. Right now, we're looking at ways to get back quicker test results. We are working on getting results back quicker and more locally. He's hoping that testing will be conducted here in California rather than be sent back east, which is what's happening now. The most ideal situation, according to Richardson, would be localized testing. If we had testing at a local level, we'd be able to confirm cases within just a few hours to just no more than 1 day. There is no timeline as to when localized testing of the coronavirus will become a possibility.